Seeing your child unwell, especially with a fever, can be really worrying, can't it? You just want to help them feel better, and quickly. It is natural to feel a bit overwhelmed when faced with their discomfort, and knowing which medication is truly safe and effective is a common concern for many parents. For children battling the flu and experiencing a fever, the safest and most recommended medications are typically acetaminophen, often known by brand names like Tylenol and ibuprofen, found in products such as Motrin or Advil. These are your go-to options for bringing down a fever and easing those general aches and pains that come with the flu. Now, why these two in particular? It is because they have well-established safety profiles for children and work effectively to reduce fever and pain. Acetaminophen can be given to infants of all ages, while ibuprofen is safe for babies 6 months and older. Importantly, you should never, under any circumstances, give aspirin to a child with the flu or any viral illness. This is because aspirin in children can cause a very serious and potentially life-threatening condition called Reye's syndrome, which affects the brain and liver. Acetaminophen works by acting on the heat-regulating center in the brain, while ibuprofen is a non-steroidal anti-inflammatory drug, meaning it also reduces inflammation in the body. Understanding these differences helps explain why they are effective and why aspirin is such a risk. When you are ready to give either acetaminophen or ibuprofen, the most critical step is getting the dosage right. Always dose according to your child's current weight, not their age. This is because children of the same age can vary significantly in weight, and medication dosages are directly tied to body mass. Carefully read the package instructions and use the measuring device provided with the medicine, such as an oral syringe or dosing cup. Never use household spoons, as they are not accurate enough. Keep track of when you administer each dose to avoid giving too much too soon, and if your child seems to have missed a dose, do not double up on the next one. It is also helpful to remember that a fever itself is not always a bad thing. It is actually a sign that your child's body is actively fighting off the infection. The goal of fever medication is not to eliminate the fever completely, but to bring it down enough to make your child more comfortable. This understanding can help alleviate what some healthcare professionals call fever phobia, which is the excessive worry about fever itself. Beyond medication, ensure your child stays well hydrated by offering plenty of fluids like water, broth, or electrolyte solutions. Dressing them in light clothing and providing a comfortable, cool room can also aid in their comfort. By choosing the correct medication, carefully following dosing instructions based on your child's weight, and focusing on their overall comfort and hydration, you can confidently and safely manage your child's flu symptoms at home. Remember, while these tips empower you, always consult with your pediatrician or a healthcare professional if you have any doubts. If the fever is very high, if your child is unusually fussy or lethargic, or if their symptoms worsen.